Hello, it's Dr. Rhonda Johnson. Today is Tuesday, February 21st, 2023, and today I'm discussing persistence of SARS CoV-2 virus infection. Well, I'm going to be highlighting some findings from 4 different publications. Now, we've known since the early days of the pandemic that the virus can persist in the body for some time after infection. Well, I'm first talking about the heart. Well, we know that SARS CoV-2 can cause acute myocarditis, but it also can cause subacute and chronic myocarditis, with clinical manifestations occurring 1 to 6 months after an acute COVID infection. Well, there's an article that was published in Clinical Cardiology in July 2022, and researchers performed biopsies of heart muscle in 14 patients. And in this study, they showed the persistence of the virus in the heart for as long as 9 months post-infection. Now, looking at the GI tract, another publication reports lingering SARS-CoV-2 infection in the stomach and gallbladder on biopsy specimens of people who were undergoing bariatric surgery between November 2021 and May 2022. These tissues, stomach and gallbladder and other gut tissues, can retain the SARS-CoV-2 virus particles for more than 1 year after the resolution of symptomatic COVID. Another study looked at tonsils and adenoids in children who had to have surgery between October 2020 and September 2021. There were 48 patients undergoing tonsillectomy and adenoidectomy, and SARS virus genes were detected in 25% of these kids. And none of the kids had experienced any signs of acute COVID infection in the month prior to surgery, meaning they were asymptomatic infections. And the SARS-CoV-2 genes were detected in the tonsils, the adenoids, and the cells from the nose. Now, lastly, I'll highlight a recent preprint study where researchers from the UK looked at genetic sequencing, and they found chronic and persistent SARS-CoV infection. That means infections lasting longer than 60 days in over 380 individuals. Again, they use sophisticated genetic sequencing analysis. Now, these researchers note that there is uncertainty regarding how common these persistent infections are in the general population, how long these chronic infections last, what their potential is in terms of mutation of the virus, and their contribution to long COVID. No one really knows the answers to this just yet. But what I thought was interesting in this preprint publication was these researchers estimate that anywhere from 1 in 200 to 1 in 1,000 of all SARS-CoV-2 infections may become persistent for at least 2 months. So clearly there is still so much to learn about this virus, and my hope is that funding will continue so researchers can continue their research so that we can advance clinical treatments. That's my message today. As always, be safe out there. The best COVID infection is indeed the one that you never get. Be careful.